I'd like to thank Deputy Ward for bringing forward this important motion and addressing this important issue. And I think many people have cited the enormous need, most of it unmet, for mental health services. The unacceptable situation of thousands of people waiting for assessments of needs, way beyond the 3 months that is supposed to be their right to get that assessment, and the 3 months beyond that to actually get services, when in fact people are waiting months and months, sometimes over a year, beyond that to get those services, or indeed not getting them at all in some cases. 2,500 children waiting for CAM services, 8,893 children waiting for primary care psychology. As of January 2019, January this year, 3,345 adults waiting for counselling treatment, and of course the lack of 24/7 emergency services. We have reports because of the lack of services, the lack of staffing and so on. Report in one paper today, and I've heard lots of stories of this, over the over-medicating of children to compensate for the lack of psychology services, OTs, speech and language therapy, and of course these problems then building up and becoming worse because we don't get the early intervention in terms of assessment and services at a young age. These problems becoming intractable, permanent problems that cost the individuals far more when they get older, and our society generally far more. And the point about eating disorders has been made by others. My office, we're talking to one of the young women whose story has been put around the place, just describing how, you know, her eating disorder is so severe and begging to get into hospital but can't get into hospital, literally, unless you're on death's door or you have the money to go private, and the shocking situation where millions are allocated but not actually spent, and then the money for eating disorder services actually suspended, having initially not spent that money. Now, the point I want to make about all this, and others have rehearsed it, the need for these services, the desperate, urgent need, magnified now by COVID, where, for example, in the case of eating disorders, a 66% increase in eating disorders. What do we need to actually address these things? And what we need is trained professionals. And you would think, given the desperate need for these services, that we would be doing everything to train the professionals. And I want to make a particular point. I made this to the Taoiseach a couple of weeks ago, for psychologists. Are we making it easier for people to become qualified and to get doctorates in psychology? No, quite the opposite. Quite the opposite. We are making it extremely difficult. MA fees of between 8,000 and 15,000, such that many of the people who are doing MAs actually go to Holland because it is cheaper to do an MA in Holland. And then when you have to get through that, you have to have a certain amount of placement hours, which is very difficult to do, the cost of travelling, on placement, unpaid placements, like our student nurses and midwives. But if you want to do a doctorate in counselling and education psychology, no funding whatsoever. You have to pay €15,000 in fees per year for 3 years. You have to work unpaid placement, which is nearly full-time, as well as doing all your studies, seeing clients and so on. So people trying to study in education and counselling psychology, living in poverty, many of them drop out. About 45% of student and training psychologists say they want to leave the country altogether. Such are the horrendous conditions. In clinical psychology there is some funding, but the number of places is absolutely pathetic. In 2020 there were 52 placements for doctorates in psychology, with hundreds of students who have undergraduate degrees and MA degrees and loads of training under their belt, chasing only 52 places. They can't get on the courses because there's not enough places. And then We have 402 less psychologists than was recommended in Vision for Change back in 2006. So we are not putting the resources into supporting young people who want to become psychologists, who want to help address the mental health crisis. We are making it difficult for them, and we are grossly understaffed and resourced to meet the desperate needs that exist in this area.